Hey guys, how's everybody doing? Good? Okay. Usually no one tells me that they can't hear me, so I just want to confirm everyone can hear me, correct? Yeah, it's the value of having a voice this loud. I'm going to warn you guys now, I speak very, very quickly, but I think that might be a good thing right before lunch, right? We can keep it going, right? Okay. I always appreciate the last two presenters, and I thought, oh, it's so nice to stay on one picture and just talk for a while. You're going to see it go real fast, guys, so if you're starting to get tired, you got to stay with me, okay? So thank you guys for being here. I'm really honored to be here. Thank you, Candace, for reminding me that, yes, I am running the second largest conference in ABA in the world 2 weeks from now. So if I seem a little off today, guys, my apologies in advance, all right? But I am excited to be here. And I do want to take a moment to specifically thank the board of directors for Illinois ABA. I realized that I couldn't remember if it was Basil. Anyone with me? I'm dating myself, right? Anyone? No? Okay. Kids don't know. Ask somebody else about that that's over the age of 25. All right, guys. Quickly, though, before I bring up my contributors, you'll see that I did make a special note here to specifically thank Candace and Scott. It's very nice of you to acknowledge that I was your professor. I have a few other former students, Chicago circa like 2006 to 8. So, and I'm sure they were pretty traumatized. So the fact that they're still here in the room is pretty good stimulus control on my part, I'm going to say, right? Scott and I actually went to grad school together. So combined, I've known the two of those guys for over 40 years, which of course is way older than either of us are individually, right? I want to thank some contributors to this talk. My organization, we're really lucky. We have 180 employees, well over a dozen BCBAs, so everybody helps all the time. But these names in particular really contributed to what I'm going to say to you guys today. And there's two people in the audience. I won't name them, but if I mess up and you guys don't like it, then I will name them so you can blame the two of them, all right? Does that sound good? Thanks, guys. All right, guys, I did do a revised title. I'm trying to be cool. I hadn't even looked at Facebook until under 4 years ago. I swear, true story, all right? So I still don't get what the hashtag thing is, but I keep being told I'm supposed to use this. So I'm going to come back and try to explain this a little bit more. Thank you guys for staying with me. Let me get my notes and let's go for it, so that people don't get too hungry waiting for me. All right, guys, so who am I and how did I end up here and now? I'm not going to go into a ton of background information. Candace was just lovely to do that. And my only reason for bringing up these organizations is that if you know any of them at a glance, you can tell pretty quickly why it is that I'm in a position to be talking about ABA across ages. So I've been very fortunate throughout my career to work with different ages, different diagnoses, and in different settings. Also, in addition to being in clinical practice, I'm really lucky that I was a professor for a long time as well, so I get to see that side of things. And for the non-academic or clinical organizations up there, these aren't my memberships. I'm actually a scientific advisor or have been on the board. So being able to be across those roles is why I'm in the position to be able to be here, which is really exciting. And I just feel very, very grateful that I had mentors in all of these organizations that have helped me along the way. So I always like to just acknowledge that. I don't like to acknowledge this, but I have to. I'm not talking about my research today, but in case you want to look it up, I kind of have to acknowledge that there's a few different names that I'm published under, all right? These are the primary journals. We're not going to make a big deal out of this, okay? That Dr. Tarbox girl is doing just fine. I joked when they were talking about the New Orleans story and Mitch and the notion of saying to someone, I'm getting married, and he said, I'm into sexuality. When someone says to me, I'm getting married, I say, congrats, I do it all the time. All right. So we're going to move on, all right? And why am I talking about my scope of practice, my publications? Mind you, most of those publications, a lot of them are with kids, actually, guys. But we do have some with adults. I pop those up. I'm going to give you guys links to that because I'm not making this a research-based talk. I do want to acknowledge that we are dealing with scope of practice here, right? And more often than not, when people ask me to come talk about providing services beyond early intervention for kids with autism, the first question is, how do I get experience? Because I can't, it's out of my scope, right? So I just encourage you to go back and look at this. There's actually an and or, I'm not gonna highlight it for you, but it says and or consultation too. So I'm not saying that you shouldn't have strong mentorship, strong advisement, but please don't think that you needed to focus on one population your entire career in order to be able to work with that population. So I just wanna remind you all to go back and look at that language, okay? So with this, let's see if I can keep going. I can. Like I said, I'm not making this a database talk. I have plenty of data. Feel free to go to those journals. If you do want to hear a little bit more about research, I was fortunate enough to do a webinar a few months ago. Dr. Justin Leaf presented on research in applied settings for children, and I presented on conducting research in applied settings with adults. And I did go through a few of my older investigations on that topic. Actually, me and Pat Fryman have even published on research with adults with neurodevelopmental disorders. So if you want to hear about my research, please go there. I'm going to go a little big picture today. And I just need to clarify that Dr. Kazemi and I totally did not hang out before this talk, I swear to you. So hopefully everyone will have the same moment I had this morning, which seemed like we were like having a slumber party or something, and we weren't, okay? I swear we weren't. Oh, and that code will take you right to a list of talks. So if you click on the one that says CALABA webinar, it'll go to the YouTube, which is linked to the CALABA site if you're interested in the researchy part of it. All right, guys, so who are you? Fair warning, I did create this talk for people in ABA. Turns out y'all are. I was looking around this morning to see for hands to go up, so thank you, because this would have been awkward if you weren't, all right? I did assume you're in one of three categories. I try not to make assumptions, but I assumed you're in one of three categories. One, that you primarily only support children in traditional settings. I don't know why I put it as a question. I think I was going to ask, but we're going to move forward, all right? Because I said I'd keep it fast. My main thing being that you want to stay in that population, but hopefully you chose to stick around for this last hour before lunch, because even if you're working with young children, you're possibly wanting to hear, is there something that maybe I need to change up a little bit to be able to better prepare them for adolescent, young adults. So I don't expect everyone to want to go across ages. Some of you, and I know especially in Illinois, I used to be a professor here, I've practiced here, I have a lot of students from here. It's very different than California, but I'm pretty familiar. And you guys do work across a lot of ages, right? When I was at UNR, the University of Nevada, Reno, I got there in 99, 2000, and Trinity had opened there, to give you guys an idea of how much I have this kind of long-standing connection. My family's from here as well, all right? So just a little personal background. I'm really happy to be here. But I know a lot of you guys work across ages in service settings. That's not the case as much in California, guys. So it's pretty much anyone in ABA is with young children diagnosed with autism. So I just wanted to point out that some of you might be in that second group. And then finally, you are only with children, but you do want to expand your scope of practice, and that has been a big focus of our area, specifically at my organization. So why am I comfortable talking across all three groups? Because we do have something in common, right? No matter which of those you're in. Hopefully, is everyone pretty much in one of those, right? If I didn't capture you, I apologize, all right? Doing absolutely everything that we can to help each individual child, adolescent, and adult successfully navigate their future, right? That is what we're all in this for together. So that's what I'm going to try and focus on today. I will jump up some data, even though I said I wasn't going to talk about data, right, guys? No matter who you are, we have a shared responsibility. I'm going to start with some California data. I was fortunate enough to give a talk last year at CalABA with Leanne Christian. She's the Deputy Director of Community Services at DDS in California. And she showed these data from the regional center system, and I just want to orient you guys to the two middle ones there. The dark blue is 10 years ago, 12 years ago, actually, and the light blue is now, or 2 years ago, all right? 6 to 9-year-olds is what I circled there, and 13-year-olds, sorry guys, I can't see, 13. And it's hard to see the numbers, guys, but combined that means that in California we have 40,000 people that in the next 5 to 10 years are coming up through transitioning to adulthood. So just a reality check there, right? When I was preparing for this, and again, not having a slumber party with Ellie, and I pulled up the TRICARE report that I'm going to show you guys in my talk today, I realized, oh wait, these data are probably drastically lower. I wasn't even thinking because of the regional center system. If you're not familiar, ask someone else. But because of insurance laws now and because of the mandate, I was like, whoa, wait a minute. We actually don't know at all, according to regional center and DDS and the state, how many people with autism are in this age range because of people shifting to insurance, which clearly is now obviously going to happen in Illinois. And already is. And then as you guys move into licensure, when you see that funding spread across, we're going to have a hard time capturing our data. So I just want to orient you guys to that. But still, that is the number. Let's look at a few other numbers that are important. Oh, money, 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 right, guys? If you can't see it, don't worry. I'm really a big fan of these red things. Then I just tell you what I want you to look at anyway, okay? So the cost of caring for Americans with autism had reached $268 billion in 2015. They are estimating $461 billion by 2025. All right, so that is the type of numbers that we're looking at, guys. And yes, again, I'll stop commenting on slumber parties, but I did want to comment on a few different articles that came out. And Ellie didn't get into this one as much, but this was a recent one as well that just came out. Why am I bringing it up? Look at the date there, guys, February 2020, so really just came out, all right? And this is an article on services for adults with autism spectrum disorders. And I'm just going to quickly show you their data. So they are estimating that between 70,700 and 101,000 youth on the autism spectrum will turn 18 years old this year. So in other words, we're looking at over 1 million in the next 10 years, all right? So I don't know whose data are more accurate. I'm just showing you guys the numbers. I oftentimes don't focus this much on autism, but it was helpful for this talk today too, so please know that. That's kind of part of my shtick, is that it's across diagnoses, but out of curiosity, how many of you primarily focus on the diagnosis of autism? All right, then I did a good job, thank you. That's all I wanted to hear. All right, guys, there's those highlighted for you on those numbers there. So I'm not going to spend a bunch of time talking about my organization. Thank you, Candace, for the brief comments there. I bring this grid up only because I've been really shocked at how much it seems to be surprising people. And I hope it's maybe more of a California-centric thing than in Illinois, but I've also noticed when I talk to people from the Midwest, the minute we start talking about ABA outside of young children diagnosed with autism, we seem to reference a waiver or a code, and we seem to get further and further away from just our language. I'm not saying that you're not doing ABA. I'm going to focus on this for a lot of my talk today, though, guys, all right? And I first did this grid in response to actually a behavior analyst in the state of California that was confused about one of our service lines, and I was like, what are you talking about? We offer 6 service lines at our company, and this is how we look at them. I call it now traditional ABA. When I say that, I'm talking about younger children in school or home-based settings. We have a severe problem behavior line that was released for people who are at risk for an inpatient hospital admission due to the severity of their problem behavior, all right? So that's across ages. We have a community-based day program. I only did that because when we were successful in our severe problem behavior line and I went back to the funders because I am waiving my least restrictive, ready to transition, I don't need this high-end contract, where can they go? We did our job, they're ready for a day program. And they all looked at me just like you guys are right now, okay? So I was like, oh, yes, I'm starting a day program. So pretty much all of our services have come out that way. We do operate 4 homes. I'll talk briefly about those as well. They are all for young adults, primarily diagnosed with autism. And we do have social skills. So these are all our service lines, but they're all ABA. And I know it's a lot up on the slide, but I just want you guys to see it quickly that this is how we talk about it, just by ages, service settings, and across these areas of skill acquisition versus problem behavior. But it never occurred to me that it was going to be mind-blowing to people for us to look at it this way. So hopefully it's not too mind-blowing for you guys. I do get a lot of calls. I'm very lucky. I'm on, I guess this is number 4 and 9 invited events across about 6 months. And a lot of them do want to hear about our community living homes. I'm not going to spend a lot of time on that, but I did want to just pop it up. We did open 4 in 16 months. So those are those ribbon cutting ceremonies. So we definitely, thanks guys, we definitely learned a lot though in that process. So for those of you that have ever done anything like that, you know we messed up quite a bit. So I tell the story about messing up in this talk if you want to see it. So I was invited to the Law Summit, which is a talk or a conference that's put on by initially Lori Unum, right, as in Ryan's mom, as in Ryan's Law, as in why we're all here in this room for funding and insurance, right? So she had asked me to come and talk about the opening of those homes and asked me to get a little more personal. So if you want to hear about an ABA provider opening new community living homes, please feel free to check out this talk. And I do get more personal. You see that picture up there? That is 16 years ago. That is my now teenager. And I was nursing him in the hallway when I was defending my doctoral dissertation with Linda Hayes and Pat Fryman and Pat Gezzi and all these people in the room. And I never would have thought in a million years that 7 years later he would have a massive regression and we would be having in-home ABA services. So I am a mom as well. So I talk a little bit about that story if you want to hear that side of things. But for today, since I'm this far in, you're like, how long is she going to keep talking about what she's going to talk about or what she talked about somewhere else, right? Okay. I'm ready now. You guys are awake though, right? See, did I keep it going? All right, good. I am going to talk about ABA for children versus adults. I'm going to talk about misconceptions, threats, and the use of our technical language. I'm also going to talk about that hashtag 24/7, excuse me, right? And then what can you do, guys? So this is my goal. Let's see how quickly I can go. I'm going to make this story pretty quick, but it's an important one. I've had a mind-blowing few months. I mentioned a moment ago that I was getting these calls to do these talks, and I had kind of hidden from the conference thing for a while. There are a little too many ex-husbands running around. So anyway, and so when I came back, I was like, I don't know if I really am ready to be back out there again. Like I did this a lot before, and I thought, you know what, I should call Peter Gerhardt. If you don't know who Peter Gerhardt is and you work with adolescents, young adults, please Google his name. This is a prolific practitioner and researcher, and we've known each other, and I said, Peter, will you do me a favor? Will you meet with me on a regular basis? Because I'm at a different point in my career. I don't need to, brand my company. I'm not looking to, get on more boards. I'm trying to run away, right? So I said, I want to make sure if I'm talking that I'm giving something that's really useful and valuable to practitioners out there. So will you meet with me? And I could spend 5 hours telling you about our monthly calls. They've been phenomenal. And I encourage you all to make sure you continue to seek out mentorship at any point in your career. And I'm going to tell a quick story. At one point, Peter had asked me if I knew about this very famous center-based program for kids with autism. And we were talking about it. He was talking about staff training. He works, again, with adolescents, young adults, and adults. And he's like, oh, Rachel, it's so amazing. And Peter's a Jersey guy. He's like, Rachel, oh, wait, hold on. Current Facebook profile picture. I always got to give him credit for that, right? So he's like, Rachel, it's so amazing. You walk in this center-based program, and it's like an orchestra. Like, their timers are all going off perfectly. Like, they all turn left at the same time. They turn right at the same time. Their instructions sound exactly the same. It's like, awesome. And he goes on to something else. And something about it stuck with me. I was like, that's interesting that those were the salient parts of him comparing and contrasting what his classrooms looked like, which he essentially was saying looked like a shit show. But anyway, the next day, that is, we call this the Joanne Giggle story. I don't embarrass her by showing her a picture of her, although she is in the room, guys. That is her finger there. The next day, I was in my Northern California office, completely separate from that moment, and I heard a couple supervisors talking, and they were talking about training a supported living staff member. And they specifically were saying, hey, we know the individual that we're working with really likes it when you talk a lot to them. And I wasn't in the conversation, but I interrupted and I said, oh, guys, I like that. I like that you're getting that kind of detail and not just saying, are we going through the behavior scale plan? Are we going through, you're talking about an interaction style, right? Write that down. And Joanne, not in the conversation, starts giggling. And I was like, what? What's funny? She goes, I'm sorry, totally off topic. When I was in early intervention and I was a direct staff member, the only piece of feedback I got was that I talked too much. She's like, oh, it just made me laugh to hear you right now. And it's off topic. And I was like, no, actually, that's a really important point. That's interesting. I even have a publication that very clearly says, if you're working with a child, say, pick up crayon. Do not say, hey, buddy, why don't you go on over there and pick up that crayon, please, right? I can give you a really good behavior analytic account of child development as to why it makes more sense to use less words with a learner with autism at that age. I can also give you a really good behavior analytic account from a child development perspective, a development perspective, as to why you might want to do exactly the opposite with an adolescent, a young adult, or an adult, right? So this got me thinking, like, what is going on here that we're suddenly starting to talk about these early intervention things as if they're ABA. At the same time, I did a podcast, a nice lady named Behavior Babe, if you don't know her, Dr. Kelly, she's awesome. And she had, I referenced a podcast on her podcast. See, I'm picking this stuff up real fast, okay, guys, right? I had referenced that Lori, again, had said to Dr. Kelly, hey, you know what? You are a BCBAD level person. You would never put in a program for an adolescent that's on sorting colors. And I told Amanda, I said, look, I was excited she said it, and at the same time I was simultaneously super bummed because I've seen a lot of BCBAs come in, work with adolescents and say, we're just gonna do sorting colors that they've been likely working on for a decade, all right? And it just, again, got me thinking, what is happening here in this comparison of working with young children, working across the ages, and are we starting to get a little confused about that which is ABA versus that which is children and that which is adolescents, adults, and young adults. And we came up with this tagline that I started using more and more. We said, guys, ABA is not defined by electronic platforms, mechanical sounding instructions, clipboards, timers, and tokens. It's just not. And actually, I just recently updated this. The dorks in the house that know me are like, that's new. I'm not going to go into this one too much, but I realized that the Behavior Babe story was slightly different, right? That was more about a clinical programming decision versus some potential rule that we have in early intervention that we're treating as being something that's ABA. Stay with me here, guys, all right? Because I worry, and I've heard people say this, I am an author on the almighty skills curriculum, right? But I heard people get concerned when they started to give this to their BCBA supervisors that they were suddenly going to just be clicking on the next SD, and we were going to be getting further and further away from that which defines true clinical programming based on a foundation of behavior analysis. I hope you saw Carrie talk yesterday, okay? If you didn't, see her speak again, all right? And so that's what I mean by that, by the way, guys, it shouldn't even be called an SD, and if you don't know why I'm that, you should think about that. It's an instruction. It takes a lot of work to make something an SD at another moment where I'm like, let's be careful about what we're just plugging in. So my biggest point here, and I said this to Peter Gerhardt the next time we talked, I said, Peter, do you think it's valuable? I've been thinking more now. I said about the original story, then the Joanne thing, for me to stop and say, what is ABA versus what is ABA for children and what is ABA for adults? And he's like, yes, Rachel. I said, okay, so here's what I'm doing, guys. Where did this take me? Oh, my former students are going like, oh no, don't do this. I'm gonna do it, guys. Let me look at my notes to make sure I'm on time. I am just a little bit here. All right, I think that there's some confusion, as I just said, around what are we talking about when we're talking about ABA, what are we talking about with early intervention, and what are we talking about with other ages? And I think the confusion comes back to our processes versus our procedures. We all know that we are here to improve socially meaningful behavior, okay? What does that mean? I'm a Fryman girl as well. We keep referencing him, right? He actually says increase the good stuff. I always slip and say shit, so I just took out the stuff, all right, sorry. All right, he says that's what we're doing. We're trying to increase the good stuff, right? And he says we're trying to increase or decrease the bad stuff. Good, right? We all know how to do that, right? This is it. I joke. I have my PhD in no duh, all right? You want something to happen, let's look at what happens right before, and let's look at what happens right afterwards, and then let's keep looking at what happens, okay? All right, we got that, okay? Processes, also referred to as concepts and principles, although I might change my language on that. I often say the basic behavioral mechanisms in operation, and if you walk up to me with any clinical programming, I'm gonna say, talk to me about the basic behavioral mechanisms in operation. What am I talking about? Things like reinforcement, extinction, generalization, discrimination. Those are processes. What are procedures? Token systems. Discrete trial, natural environment, task analyses. FBA. Preference assessments. PECS versus sign versus augmented communication. Oh, that little thing called ACT. Okay, these are procedures. Why do these procedures work? Because of the processes, all right? And I'm starting to get concerned that people are confusing these things. For example, most common one that happens, I think you'll all be with me on this one, please do not tell me that extinction means that you're ignoring the person. Are we good on that one? Yes, thank you. If you're not, that's okay. I'll say it to you real quickly. Extinction is breaking the response reinforcer relationship, right? So you gotta do an FBA first. You have to decide what is the behavior and what is occurring right after the behavior and before that is reliably happening, and the behavior continues to happen, right? Oftentimes, there is problem behavior maintained by attention. As we just heard, there are a lot of things that we might think is sexually inappropriate behavior, but it's actually a behavior that has gotten maintained by attention, right? So extinction, yes, in that scenario would be no longer providing the attention, okay? Mind you, by the way, guys, that doesn't work alone. We still got to use the other process called reinforcement, but is everyone staying with me? Yes, a little bit here? Okay, if the problem behavior is maintained by escape from demands, right, we got a whole different problem there. Extinction looks differently. You don't want to ignore them. If you ignore them, and then what are you doing? You're increasing the behavior, right, guys? So if you don't know the process that makes a procedure that uses extinction work, then you might be reinforcing problem behavior. So that is one example I wanted to use. What was another one? Oh, the token system one. It's a big one, all right? Token systems, guys, I'll blow your mind on this one. If you don't know the processes involved in a token system, mind you, it's actually all of those things right there, all right? Some aren't. You actually could be committing an ethical violation. You should not implement a token system immediately with a response cost. I will leave it at that. Linger on that for a little while. People say the, oh, thank you, I like the applause, Karen, thank you, yeah. People say the strangest things. All right, guys, this came from me recently as well. About 7 months ago, 8 months ago, we started hiring people at my company that were already RBTs. That was new for us, right? I'm sure it's happening to some of you now. I usually start at training and I say, hey, we're having a moment right now. You're all looking at me. You're my environment. You're influencing my behavior, right? And I'm saying vice versa, right? So same thing, right? Behavior environment goes both ways. If you suddenly started looking bored, it would influence me, vice versa. And the RBTs will look at me and say, I am so sorry. I had no idea. I thought that this was just for something with young children diagnosed with autism. Something's going on there, right, guys? So, and that person was supervised by a BCBA. That person, I won't even get into whether or not you can pass the test and become an RBT not knowing that it actually involves stuff beyond kids with autism. Let's not even go down that path. I have to spend a lot of time with Justin Leaf, so I go down that path a lot. Wait a minute. The BCBA who was supervising them for a minimum in the 40 hours that they went through the training never once mentioned this kind of notion of ABA and behavior and then, right? So maybe it makes more sense that we see things like this, right? This is where these sentences come from, right? The scariest to me, obviously, being the last one there. Okay, guys, what do I think is happening here on some of this? I think these misconceptions, again, are, unfortunately, I think a lot of people don't know what ABA is. And I'm going to include some of us in that. And I am not trying to insult anyone. I am not trying to upset anyone. I hope it doesn't come off that way. If it does, please talk to me later, guys. Because like I said, my goal now is just to try and do good work and help other people to do good work. I'm not, there's nothing else going on. It's a cool phase of life to be in. Took me a while to get here, all right? I am saying again, I think that maybe they just know the procedures, and I think that this is a big, big concern because they don't know why those procedures work. And that can be very, 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 very scary, all right, guys? So knowing the why, I believe, decreases some threats to our continued practice, which I'm going to talk about in a moment, all right? I am going to make us all geek it out, though, for a second as well, because I think that there's some confusion when it comes to our technical language. This is a quote. Dr. Colombo, who works for me, pulled this up, which I was thrilled to see because these are behavior analysts that wrote this. So it says, practicing behavior analysts should avoid the use of technical language because it might lead to affect social validity of treatment. Everyone take that in for a second. How many people are worried that when we use our technical language, that we're affecting the social validity? Let's stop. What's social validity, right? We're saying whether or not caregivers, stakeholders, funding providers think that what we're doing is valid. That's a big statement, right? So thoughts, you guys think that our technical language makes people not like ABA? Okay. Let's talk about that. Ooh, lots of words, sorry. I warned you guys though. My arrows come in handy, are we ready? All right, looking at my time. Let's just go upper left, all right guys? It's only my old students laughing, right? What should you say? You should say that's not a good session because the person died, okay? That's why that is not a good session, all right? Okay. Now, if you're waving your BCBA flag, you're going to come in and you're going to be like, if someone says, what, why, I'm sorry, what, why? And you're going to be like, because a behavior is only something that is observable. Great, you just totally, they're like, oh, thank you so much, right? I want to take this a little further. What is the clinical limitation in that moment, in that interaction? What's happening clinically with that person that you're talking to, that direct staff member that you just left to say there was no behaviors this session and it was awesome? We're now missing an opportunity to make sure that that staff member understands that everything we're doing to reduce the problem behavior is exactly the same stuff that we are doing to improve a skill deficit, and both of those things need to be going on all the time. So we want to make sure that person should also be saying, it was a great session, they learned so much today, right? So it's getting us further away from ensuring that the people understand that these processes are influencing our behavior, regardless if it's good or bad, or our age, or our diagnosis, or the setting. The processes are the evidence base, guys. The processes are what makes ABA, not the procedures, okay? Don't get me wrong, we use an ABA framework to evaluate those procedures. There's data to show whether or not PECS or SIGN might be better, right? There's data to show the effects of a token system. But even when data support those procedures don't become ABA. We're using an ABA framework to document their effectiveness. Please be careful, guys. Oh, again, the student didn't generalize it. I'm gonna be such an ass. I'm gonna say, please don't say that. Please say that we didn't observe generalization. If I just leave it there, boy, do I sound annoying, right? Real story for me. 20 years ago, I was training a public school teacher. They're the best, by the way. Shout out to Candace, everyone in Illinois. Actually, any of my former doc and master's students that come from here, like a large percentage were special ed teachers. It was very cool, okay? And I'm the annoying one in their classroom 20 years ago, so I was like 10, right? Saying, I'm so sorry, and I would correct the teacher, can you, let's say we didn't observe generalization. If I left it at that, boy, am I causing social validity issues with ABA, right? No, I'm not doing that just because that's the rule and I gotta say the right rule. Why am I gonna make sure that I do that? And I'm gonna explain why I'm doing it. That's the take-home point, right? I now need to say to the person, hold up. If I let you just say the kid didn't generalize it, whose fault is it? The child. We just put the locus of control inside that kid. We are now saying there's something wrong with that child. That child has a deficit that made it so they can't do something. If I instead use our technical language and explain it, say, hey guys, we really need to say we didn't observe it. But why am I saying that, guys? Because if we say we didn't observe it, now we're all more likely to say, hold up, what do we need to be doing differently? How do we change the environment? How do we switch up our procedures? How do we do that? So that's my argument for you guys today, all right? So what am I saying you do in terms of decreasing misconceptions and threats? Constantly consider the potential benefits of using and explaining our technical language. So hopefully this rings true for some of you guys today, guys, because I'm arguing that that gives us increased quality, improved adherence, and exponential buy-in. So yes, I am saying the opposite of the quote that you guys all agree with. So hopefully that took you for a moment there, all right? What happens when we get overly focused on our procedures? January 2020, this just came out. My understanding is that Alfie Kohn is pretty well known and liked in the liberal arts world in particular. We need to pay attention to this. This is out there right now, all right? Similarly, again, Ellie and I are not having slumber parties together, but I will bring up the TRICARE report, all right, guys? So what did TRICARE say if you can't see it up there? They actually, that's an insurance company, military families, everyone with me? Yes, over 70% they are claiming showed no progress. They said 9% of the kids with autism that got ABA worsened, all right? This is out there, as in like the last few months, right, guys? People on our side are making good comments about this, so that's good, okay? They're coming out. What are they saying? She took a look at the data, okay? And she said the average intensity was only 5 to 20 hours, and they were providing less than 10 hours on average, okay? And there's lots of data to show that low intensity won't work, so maybe this is it. Great. TRICARE still put it out there. There's still plenty of people that don't know to look at it like this. And sure, I will agree that we need to consider, is it an adherence issue? Is it a treatment integrity issue? Or is there something wrong with the clinical programming that was going on for those individuals in that study? And I feel like I'm not supposed to say that, but I think we kind of have to look at this, guys. I think we have to look at this. Why? Because we're all in this together, okay? Success with children, those of you that are in early intervention, thank you, all right? Because your success based on a foundation of ABA will increase the funding for all of us and keep the grad programs going, all right? Yes, it will decrease the need for adult services. I don't think any of us need to worry, okay? Especially those of us that are working with adults. We know that, all right? And I know you guys are going to be facing a lot of what we faced if someday probably we're shutting down those developmental centers, guys. That's why I run 4 community living homes, okay? So this is going to happen for a long time. We're not out of a job. If you fail the early intervention people, and I do early intervention as well, CABA does all ages, right? Our funding will go down across all ages, and the need is going to increase for adult services. So this is scary. We need to be very careful. And I think part of the problem is this whole notion of saying, how many hours of ABA do we need? I know I'm saying a lot of stuff today, huh? Is anyone with me still? No? A little bit? Why not? I figured I'd go for it. Let's go for it. I want us to consider 2 things. An example from the medical model, and then I'm going to talk about this dude from the 80s that kind of made this 40-hour thing seem important. Hopefully some of you know who he is. Let's talk about physical therapy. How many people have had to have the physical therapy, if you don't mind? Sorry, that's actually really inappropriate of me. Sorry, HR. Sorry. Did not mean that. I'm learning. Hey, guys, I'm the weird person who opened a company like in my 40s, right? I'm supposed to be 22 with a logo and a website. I understand that, all right? So I'm still having to wrap my head around being an employer. But, all right. So you go to physical therapy, right? You're going to get a half an hour a week. We all know that, right? Okay. No one thinks in a million years that it would be helpful for that person to follow you around 24 hours a day, 7 days a week, doing exactly what they did in that session, right? That would be harmful, painful, intrusive, awful, right? However, you ask any physical therapist what they tell their patients. They say, great, we're doing this session, and here are the recommendations for how you need to stand up, sit down, turn your head, sleep at night. And they will say to you, the more you do these recommendations, the more you behave this way and arrange your environment to support you behaving this way, the shorter treatment dosage you will have. Whether we like the medical model or not, we all got to get used to the language. And welcome to licensure. I can tell you guys, values-based care, medical model, this is the language. A treatment dosage is what we're talking about. And we're talking about having to decrease our treatment dosages. And in medical model, they know darn well that the more you adhere to the recommendations, then that treatment dosage is less costly. More importantly, you get better faster, right? Okay, so we're fine with that, okay? I don't know why I thought this was a good example of 24 hours a day of physical therapy. For me, I guess 24 hours a day means that I'm going to the fridge at night. I have no idea what I was doing there, guys. But just like physical therapy, we're not just trying to change, in ABA, guys, we're not just trying to change behavior by implementing or during 1 session a week or 5+ sessions a week, right? Okay? We're not just trying to change behavior in that session. Oh. Hashtag 24/7 ABA. No one's with me yet? No? All right, fine. Let's try this example. Out of curiosity, if I say EVAR, how many people have the intraverbal? All right, cool. I actually didn't know. I didn't Candace, you know that? Okay, I emailed some Illinois people. I was like, well, they all know. Are they still young? Do young people know who he is? I don't know. I actually never reference him, so this is really weird, okay? Kind of very weird that I don't reference him because I worked for the lady that's in the bottom picture of his Wikipedia profile, but... guys, EVAR, if you don't know, right? Oh, wait, let's give another intraverbal. EVAR Lovas, how many hours? 40. All right. Where do you guys think the 40 hours? You know what? I'm going to run out of time, so I won't be Socratic. Sorry, it's the professor. It's the Fumis in the room that are throwing me off, okay? I won't be Socratic. I'm going to tell you guys. 40 hours? That's our work week, right? Guess what? It was the work week of the parents in the 1987 study, all right? It was also an average, just in case you didn't know that too. It did not say that 40 hours were needed in order to no longer meet the criteria for the diagnosis of autism. The individuals at UCLA in 1987 received an average of 40 hours. And again, the only reason why the number came around that 40 marker is because that's how long mom and dad were at work, okay? That's the reality. EVAR even said, I can't believe I'm quoting EVAR 20 years ago, EVAR even said, guys, that ABA needs to be 24/7, all right? None of us know that. None of us say that. Why? I believe, and I realized this recently, that I think people thought he meant that we were going to do discrete trial training 24 hours a day, 7 days a week, okay? It's not what he meant. Not what he meant, all right? So the question's not how many hours of ABA, guys. It is not. The question is, how can we provide ABA services to ensure 24/7 improved behavior change? That is the question. Don't get me wrong, funding providers, social significance, we do need to look at minimal hours as possible. But I'm making this point, hopefully it's helpful for you guys to hear today, because here's the reality of working with adults. I think that oftentimes we think it takes so much more training to work with the little ones. They definitely think that in California. I'm happy to be in Illinois with you people, okay, right? Yeah, no, guys, right? Because we got way more complex settings going on. We're not in a controlled environment of a classroom, okay? And we still need to be interacting in those moment-to-moment interactions, realizing that every moment is a learning opportunity and every moment is an opportunity for behavior to decrease or increase. And the more we capture those moments, the shorter the treatment dosage is going to be, all right? So I'm going to say it's going to cause more staff training in many ways. I also think we need to look at the quality of life for staff members that are working with this population. I usually spend a lot of time on this topic. I don't have time for it today, but I couldn't give a talk without acknowledging that. I'm not saying it's harder, it's just different. And when you have a 6'4" person charging at you and you're gonna die, like it just is different, all right? So from an employment perspective, I'm realizing that I need to make sure that there's a good quality of life for my staff as well, guys, right? If they don't have a good quality of life and they don't have good training, how are they going to start to hit these topics that we are facing when we transition to adulthood, right? Every early intervention provider is like, woohoo, communication, got it. Woohoo, social interaction, okay. Ooh, executive function, yeah, I know what that is, right? Okay, yeah, oh shit. All right, okay. I have to teach emotional vulnerability. I have to teach sexuality, religion. Yeah, and guess what? This cool thing called ABA does that because it's not about discrete trial, okay? That is a procedure that is effective in certain situations. There's other procedures, and as long as we can describe the processes, then we can tackle these things. So I am saying it's not just about doing age-appropriate goals. If you asked me to give this talk a year ago, and I did a lot, that's what I focused on. And don't get me wrong, for those of you, especially in that third category, that are looking to expand your scope of practice, yes, of course, okay? Essentials for functional living. There's a lot of good tools out there, right? Because the VB map is not going to show me a sensitive measure as to whether or not the 23-year-old is no longer destroying their home, right? So there are tools that are important to make sure you're doing age-appropriate goals and clinically programming appropriately, but that's not what it's all about. Absolutely everything about your organization is going to need to change. The biggest thing that I pop up on this is actually our intake procedures. We had two different kinds of parents 20 years ago, guys. We had a parent who was anti-ABA. We knew exactly what to say to them. And a parent who had no idea what it was. We knew exactly what to say to them. Who am I talking to now? I'm talking to people that have children that are adolescents, young adults, and they're not anti. They're like, we did it. We had a decent experience. That's not what we're looking for right now. And when I probe a little bit more to find out what's going on, I realize real quickly, they think we're going to come in and sit at their kitchen table and run discrete trials with their 25-year-old for 3 hours a day. And they've been in ABA. So this is the same as that RBT example I gave you guys. Somehow they had ABA services, and that is their understanding of what's going on. Nothing to do with the concepts and principles, basic behavioral mechanisms, that which defines the evidence base of our science. All right, guys, so I did ABA for children versus adults. Tried to hop on our technical language bandwagon there, at least if nothing else, just get you guys thinking. Tried to explain my hashtag. I'm just trying to be cool, I know. So let's see in the next 7 minutes if I can do this. What can you do? Move beyond just age-appropriate goal setting, please, guys. Always consider how what you are doing for that individual at all times is contributing to 24/7 improvements, all right? That needs to be the outcome. Speak up against all misconceptions. Please speak up against all misconceptions. Procedures are based on ABA. We evaluate them with respect to ABA, all right? They do not equal ABA, even when we've demonstrated that they are effective. They are just effective procedures, and it is a behavior analytic framework that helped us do that, a conceptual framework. Quick on some CABA-isms, all right, now? I'm lucky. Oh, as I start. Oh, no, don't choke with only 5 minutes, 11. All right. I had to do this. I got a lot of great team members. One of them's here. She has a lot of good isms. I actually was calling these Angelisms, and then I realized that I probably had too much wine at dinner and didn't remember all of them that she said, so I was like, crap, I'll come up with CABA isms, and I'll just throw one up for her. I love this. Angela came to join us at CABA, and she had worked primarily with adolescents and young adults. And whenever she hears or we tell stories about a supervisor saying they had such a great one-on-one session with a kid, she's like, oh my God, I'm so excited. That's wonderful. Out of curiosity, how did that session help them with the 8-to-1 ratio that they're going to be facing in the next 5 to 10 years, right? Okay. And that's a good reality check, all right? And I think there's 2 things that this orients us to. Number 1, yeah, you do need to be thinking about that. If you're still in a one-on-one session and you know darn well that this person is likely going to require intensive supports, you probably need to stop working on your sorting colors program and start figuring out how to practice larger ratios to help that person be more successful later in life, all right? Second thing that this makes me think of is that somehow people think when we're in the 8-to-1 ratio that it's no longer ABA. Like, hopefully that's not the case for anyone here, but if so, I'd like just encourage you to think on that because it's got nothing to do with that. Here's a Benism. I love this one too. I'd be like, oh, it's a great session. It was totally awesome. You know, we did so good, and they loved my token board, and they loved everything. And Ben, my director of clinical operations, trained so well by an experimental person. Actually, it's probably why he thinks this way. So that's awesome. What if above all else, that child's motivation is to get you to leave their house? And guess what? You've reliably done that at 6:30 every day. So that's that, right? And guys, that might be why we're seeing things like this, okay? So we need to be thinking about that. Why was he able to say that, guys? Because he knows the processes. He knows that it could be one giant negative reinforcement situation. And if that is what's going on, then you are conditioning yourself as an aversive stimulus. That's how we have to think about it because we know the research behind the processes. If we know I am not building rapport, that means I'm not establishing myself as an effective conditioned reinforcer. And we have procedures to do that. If you don't know the process, though, you're not going to be able to do that work. And you're not going to be able to fix it when there's a problem with a procedure. That's the bigger issue. All right, guys, quickly, because I am close on time here, so I do need to emphasize these few things just again to overwhelm everybody, right? When you are dealing with transitioning to adulthood, here's a good example of the list of things that we're facing, guys, okay? My punchline for you, without going into this detail, this is obviously a day-long workshop, a semester-long college course. I just couldn't go out of here without saying some of these things. It is a process. We need to begin it as soon as possible. There are good resources for this. I'll pop up some, because if some of you read my abstract and you're like, seriously, she just lectured me about ABA the whole time, fine, take a picture, go read it. You can read a book, okay? Didn't need me to bring up a bunch of bullets from a book. It's a good one. Here's another good one. And these are 3 chapters in particular that pop up that might be helpful for you guys. I rely on them quite a bit. And as if it wasn't depressing enough, right? I'm doing good, no, right? Lunchtime. Back to that article that I popped up that tripled the numbers that we've seen for the estimates of people going in to adolescents and young adults, right? Everyone remembers me saying that, yeah? Want to hear something interesting? There was 52 articles that they included, okay? This is February 2020. This is like 2 seconds ago. And these are the topics that they said they found predominantly when they went through researching services for adults with ASD, a systems perspective. Employment, social participation, assistive technology, post-secondary education, okay, great. They said 5 studies were related to behavioral services. I don't know about you guys, but we help a lot of people with employment, and it's a behavioral service. Okay, we do a lot of assistive technology. I have publications in the AAC device, and that was definitely an ABA study in an ABA journal. What do we mean? You ready for the punchline? This article didn't use the term ABA once. I am concerned that we are getting too comfortable and think that we're all safe, especially with children with autism and neurodevelopmental disorders. Don't get me wrong. I agree. I love you, Ellie. Yes, let's go rocket science. Cool. Let's talk about orgasms and masturbation. I've done my whole career going across ages. I am now terrified that we got too comfortable and we think that ABA for kids with autism is sticking around and there's no threats to it, and there is. There really is. And I believe that threat comes down to a lack of understanding of what defines an ABA approach and us getting way too caught up with our procedures and not training enough on the processes and why those procedures work. They ended by saying the field of research on services for adults on the autism spectrum remains relatively small and generally lacks a unifying conceptual framework or consistent methodological approach. Please tell me, those of you that have graduate degrees in behavior analysis understand the gravity of this statement, because we are the one science-based domain of psychology, not the one, I shouldn't say it that way. We are a science-based domain of psychology. What makes us a science-based domain of psychology? That we have a kick-ass conceptual foundation, all right, and framework, and we definitely have consistent methodological approaches. And yet, in an article released this month on that, which has to do with supporting adults with autism, we're not mentioned once, and they said this. Uh-oh. In conclusion, and just to embarrass her one more time. Oops, sorry, I should have done it dramatically. Hold on. Thank you guys very much. I very much appreciate it.